guys, welcome back to my channel, and hi to all of those who are new. This is going to be a video all about Graves' disease, specifically my story with Graves' disease. I feel pretty nervous putting this out there because this is very personal information, and it's really been something that I've been struggling with for a long time. I have really wanted to make this video for a long time because I wanted to share what has happened to me with you guys. I just wanted this video to be a place where you could come and find some information and also maybe realize that you're not alone. There's quite a lot of people out there who have Graves' disease. It's not a very common disease, but it's not super rare either. And then there is even more people out there who have thyroid issues in general, like not related to Graves. There are others, you're not alone, and that's really what I wanted to say before I start talking about anything else. I know that it sometimes feels like you're the only one, but you're not. I also wanted to go ahead and tell you guys that I'm not a doctor. I'm not a medical student or anything. I actually study law, so kind of far away from medicine, but I have really been doing loads of research, a lot of research, and I've really become somewhat of an expert for myself. I've realized that you can't rely on other people, not even on your doctors. You really have to try to be your own expert about your own disease, especially if it's a disease that's kind of rare, like Graves. So I have some notes here just because I need something to hold on to while I'm doing this, and I also really didn't want to forget anything important that I wanted to say. So let's get started. So Graves' disease is an autoimmune disease, so it's not something you can catch. It's not like the flu. You can't give it to somebody else. It is an immune system disorder that, among other things, results in the overproduction of thyroid hormones, which means that the thyroid gland, which is in your neck, it's about right here, goes into overdrive, and it actually produces too much thyroid hormones, which is called hyperthyroidism. The opposite would be hypothyroidism, which is when your thyroid does not produce enough thyroid hormones. Graves is actually the most common cause for hyperthyroidism. There is other causes, but they're less common. And hypothyroidism, so an underproduction of thyroid hormone, is a lot more common than hyperthyroidism. So what happens in your body when you have Graves' disease is that your immune system produces an antibody that kind of looks like the TSH, so the thyroid stimulating hormone. The TSH is usually or is produced by the pituitary gland, which is part of your brain. It sends the TSH to your thyroid to tell the thyroid that it's supposed to produce more thyroid hormones because your body is in need of more thyroid hormones. So what happens is your immune system sends those antibodies that the thyroid mistakenly takes for TSH. The antibody goes to the TSH receptors on your thyroid, and that makes your thyroid think that it has to produce more thyroid hormones than it actually has to. So your thyroid goes into overdrive. It produces more and more thyroid hormone. That's why it grows. Sometimes people who have Graves' disease have a visible swelling on their neck, a goiter, or a struma, as we call it here. So you get like a little bit of a ball on your neck, which actually is the thyroid gland that's just swollen up and it's grown. So Graves' disease is not a disease of the thyroid, it is an immune system disorder. So that's an important information. It's not your thyroid that's broken, it's your immune system that is sending out antibodies that kind of confuse the thyroid. It thinks it is getting TSH, but it's actually getting the antibodies from your immune system. There is other tissues in our bodies that have TSH receptors. For example, the tissue behind your eyes also has TSH receptors, the muscle and the fat tissue. There's also other places on your body other tissues that have TSH receptors, for example, on your shins And I'm fairly sure that I have some in my back because I could really feel it right there, but I don't know if that's actually true. So what can happen in patients with Graves' disease is not just a swelling of the thyroid, but also that the tissue behind your eyes swells up, which makes your eyes kind of bulge out. So you'll have like eyes that are kind of like bulging. So they're like, they seem really big and huge, and they kind of come out of your eye socket a bit. If that happens to you, so if your eyes are also affected by the Graves' disease, it's called endocrine orbitopathy, or TED, thyroid eye disease. A lot of people with Graves' disease actually do get some sort of eye involvement. There's different stages. I am actually in a really low stage right now. I have some eye involvement, I have some eye troubles, but they're very minor compared to other people's, which I'm really grateful for. So having those TSH receptors behind your eyes, on your shin, etc. will lead to discomfort and pain in those areas. So for example, you could have like really bad headaches behind your eyes. You could feel like someone is pushing against your eye from the inside. It's really uncomfortable. It's this weird kind of pain that you've never felt before. So as I said, your pituitary gland, so your brain, releases the TSH, the thyroid stimulating hormone, to tell your thyroid to produce more or less thyroid hormones. So the higher the TSH, the thyroid stimulating hormone, the lower your hormones, your thyroid hormones will be. So the more your body would need, the higher the TSH will be. So if you have enough or too much thyroid hormones, your TSH would actually go super low, or actually be non-detectable at all. So if you have hypothyroidism, your TSH would be really high, and if you have hyperthyroidism, your TSH would be really low. Did I just say that right? If Graves' disease goes untreated, it is actually life-threatening. So some people won't actually know that they have Graves' disease until they have a stroke, for example, or a heart attack. When I first heard that, I was like, oh my gosh. But it sounds worse than it is, because nowadays there is different kinds of treatments for this disease. So there's 3 methods that doctors use nowadays to treat Graves' disease. The first one is RAI, radioactive iodine treatment. That's where you swallow a radioactive pill, and it basically gets absorbed by the thyroid and kills the thyroid. Radioactive iodine treatment is very inexpensive compared to other treatments. That is actually why, or it's one of the reasons why a lot of doctors like to suggest that treatment. The second treatment is medication. You can take anti-thyroid medication, so thyroid blockers. They block thyroid hormones from getting released into your body, which in Europe you will get put on them basically immediately, like right after you're diagnosed, you'll get those pills. And in Europe, most endocrinologists will actually tell you to do an 18 months cycle of these thyroid blockers and then try to get off them and see if your Graves' disease has actually gone into remission, which rarely ever happens. And the third treatment method is actually a thyroidectomy. That means getting your thyroid removed, and that is the form of treatment that I chose for myself. I got a thyroidectomy in July. Those 3 treatments, they won't cure you from Graves' disease. Graves' disease is not something that you can cure. You can just manage the symptoms. If the treatment works, your life will be saved. So that's okay, but you won't be healed. There is no way to heal Graves' disease. All the different treatments have different consequences. So as I said, I did a lot of research when I was first diagnosed. Well, not actually when I was first diagnosed, but gradually I started reading up on what Graves actually is and all my different kinds of options that I had, and I realized that the consequences from each treatment are very different. So radioactive iodine was actually never an option for me. I knew that I did not want to get this treatment. One of the main things why I didn't want to do it was that if you had minor endocrine orbitopathy, so TED, or none at all, that after radioactive iodine, your risk of getting TED or your TED worsening is really high. So I really didn't want to risk that. Also, I did not want to keep my thyroid in after it was dead. I didn't want any dead tissue in my body, and I also didn't want to swallow a radioactive pill. There is actually other parts of your body that will absorb some of that radioactivity, for example your colon and other areas. So for me there was no question I was not going to do RAI. My doctor actually wanted me to do the 18-month medication therapy, which at first I was okay with. After reading up on it, I just realized that there were so many side effects that those drugs could have. For example, your white blood cell count could go way down, or your liver could shut down. And I was just kind of scared of those side effects. They're not that uncommon, and it's definitely not healthy for you to take those pills forever. So I was pretty sure that I didn't want to do that. And also I realized that it was a dream that's not going to come true, that my Graves' disease is going to go into remission after 18 months. It's just not going to happen, and I knew it wouldn't. I feel like that's why a lot of people take those medications, because they have this hope that the Graves is going to go into remission and that they are going to be able to keep their thyroid. But for me, I was like, that's an illusion. It's not going to happen. So I decided on getting the thyroidectomy. So now I'm going to talk a little bit more about my story, about what happened to me in a chronological order as well as I can. So first of all, I was diagnosed with Graves' disease in January of 2015. So that was 10 months ago. It was actually the 8th of January, and it was crazy for me. Getting that diagnosis, it hit me like a ton of bricks. I was sitting in the hospital bed and I was crying, and I was like, this is not happening. I was in total denial. I was like, I'm not sick. I don't feel sick. I'm doing okay. And it was so hard for me to accept that was happening. Why I actually went to the doctors was because my mom had noticed a swelling in my neck, and she told me before, she was like, your neck is kind of swollen. I feel like it could be your thyroid. I don't know though. And what's also important to know is my grandma on my mom's side, she had Graves' disease. And she had, I mean, it took forever for the doctors to find out what she had. I mean, she was in agony. It was horrible. And they found out when she was actually unconscious. I mean, she was basically in a coma. And then they figured out that she had Graves. And her eyes were just huge. Because my grandma also suffered from Graves, we kind of knew what it was. So my mom was like, your neck is kind of swollen. I really would like you to go to a doctor. But you know, I had this illusion of invulnerability. I was like, this is not happening to me. I look fine. I look like I did before. There's nothing wrong with me. But then I went to my gynecologist for something totally different. Like, I had some bladder issues or something. And I went there, and she took my blood pressure and my heart rate. She checked them, and she was like, your blood pressure and heart rate are through the roof. Something is wrong. And I was like, no, I'm just stressed, you know. I'm in the middle of exams. It's nothing. And she was like, no. It's bad. And I don't remember how high it was, but it was really bad. And she was like, okay, wow, that's not normal for someone your age. And she was like, I want you to lay down for 15 minutes, try to calm yourself down, and we'll do it again. So I did that. She came back 15 minutes later. I felt pretty relaxed. I was like, yeah, I'm kind of a little nervous, but it's not that bad. And she checked me again, and she was like, this is crazy. You know, you have to go see a doctor. And again, I was just like, this is nothing. This is nothing. These people are just exaggerating, overreacting. There's nothing wrong with me. In January, I wanted to go see my host family in Texas. And my mom was like, you're not going there, you're not flying unless you come to the doctor with me right now and we're gonna check it out. And it was like, whatever. I was so annoyed. I was being so rude to her, which I feel so bad about today. I was like, Mom, you're totally overreacting. It's nothing. So she took me to the ER because a doctor we know was actually able to get me an appointment there. So I went to the ER. They checked my blood pressure, my heart rate. She was like, how are you even standing up looking at me right now? Your heart rate is so high. You have to sit down right now. So I did, and my mom told him about my grandma's Graves' disease and about my neck and everything. So they checked my antibodies, and sure enough, they figured out that I had Graves. And the doctor was like, your heart is really concerning me. I want you to stay here overnight. Mind you, I only had like my little purse with me. I never thought that they were gonna figure out something that was gonna keep me there overnight or for a couple of days or whatever. I thought they were gonna tell me I'm fine and I could go home and my mom would be okay and I would be okay and everything would be fine. That's not how it went. So they kept me overnight because they were really worried about my heart. I had had a heart rate like up to 200 or something. It was crazy. I didn't have enough oxygen. The oxygen saturation in my blood was way too low. And the next day they sent me home. They gave me a prescription for anti-thyroid medication and told me to find an endocrinologist and get treatment. So I did. I went to the endocrinologist that was in the same hospital as the ER, and that was just a couple of days later. So I went to see her. She was really nice. She was quite young, but I felt really good. And so she asked me, you know, what were your symptoms before? What happened? Let me know, you know, tell me your story, whatever. And so I started thinking about what had happened to me the past few months, like before I was diagnosed. And I realized all those little things that I had noticed them, but I had just not given them any thought really. For example, my hands were constantly shaking like crazy. I mean, sometimes I would be writing something down and I could barely read it because my hands were so shaky. But I thought that was just because I was so nervous or so stressed because of my exams. As I said before, my exams were right around that time, so I was like, I'm just stressed because of the exams. That's it. I kept having those moments where I would just feel so sick to my stomach. And that started like half a year or even longer before my diagnosis. We were in Scandinavia the summer before, and there were some incidents that are definitely related to my Graves that I didn't know back then, but now I'm sure. We were at this one restaurant, for example, and I just felt so sick to my stomach all of a sudden. I was like, what is happening? I was dizzy. I was feeling so sick. I was like, something is wrong. Everything, like all the smells in this restaurant were just overwhelming me. I was like, what is happening? But I just told Vince, I was like, I have to go. Like, this is not even, like, I don't know what's happening to me, but we have to leave right now or I'm gonna throw up all over this table. And so we left. It was super awkward. All of a sudden it was gone like that. Like, I didn't throw up or anything. It just was gone. I was like, what was that? And that actually happened to me a few times. Also in December, right before I got diagnosed, we were in Poland, my family and I, and my mom kept telling me, she was like, you're so aggressive, you're so irritable, like what is wrong with you? You're just snapping at everybody. And I was like, I'm not, I'm just, you know, I was like, Mom, I'm just nervous because of my exams. I was constantly mad at everybody and I didn't even realize. There were some symptoms that I could have noticed, but then I thought I was healthy. There was nothing that was, you know, in the back of my mind, and I wasn't really paying attention to those little things. Also, I hadn't really lost weight. A lot of people who have Graves' disease for a long time, they lose loads of weight. It just falls off of them. They eat so much and they just lose weight like crazy, which didn't happen to me. I probably haven't had it or hadn't had it for long enough for that to really kick in. I wasn't hungry all the time. What would happen though is if I was hungry and I wouldn't get food like right that minute, I would start feeling so shaky. I would start like feeling like my blood sugar was super low. I would almost get a little panicky, like I had to get food whenever I was hungry, but I wasn't eating crazy amounts of food or anything. So that didn't happen to me. I didn't lose any weight. Some other things that were happening though was that I couldn't sleep. I had like such bad insomnia. Every time it was getting dark and I knew I was about, like, I have to go to sleep soon, I would almost get a little anxious because I was scared that I was gonna lie in bed again and not be able to go to sleep. It was so horrible, and I just remember laying in bed and my ears, I really felt my heartbeat in my ears. I don't know how to describe that, but I would just lay there. It would be so quiet and I would hear my heart racing in my ears, and I would be sweating. Oh my gosh, I would be sweating like a pig. I mean, it was crazy. And I would have the windows wide open in winter. In winter in Switzerland, it was freaking cold, but I was just hot all the time. And again, I just thought I was just nervous. And also what I noticed was I wasn't getting tired. I mean, I was like a machine. I was like working, studying, doing like 100 things a day, and I was just like, everything was going too slow for me. You know, when somebody was walking beside me, I was like, can we speed things up? Can we walk a little faster? I was just so tense. If I was walking up some stairs, like a flight of stairs, like, I don't know, like 10 steps, I would be so out of breath. I mean, and I kept thinking like, wow, I'm really unfit. And so I just started taking the elevator. You know, it's just little things like that. Yeah, now when I think back, I'm like, I should have noticed. There's a saying in German, like, when looking back, you're always smarter than you were then, which is so true in that case. After I was diagnosed, I got sent home with those pills, and I was still in total denial. I was like, this isn't bad, you know? It's not bad. It's not like my grandma's. It's not gonna be that bad. They figured it out really early on. Like, I just didn't realize the situation I was in. I actually went to Texas. I went to see my family, which was amazing. I feel really safe at their house, so even if something would have happened there, it wouldn't have been a problem. I would have been in really great hands. But still, you know, I traveled by myself for so long and flew for so long all by myself, and I think it was just because I didn't really want to think about what was actually happening to me and to my body at the time. So while I was there in Texas, I had this weird thing again where I was just feeling nauseous all of a sudden, and I actually did throw up for like one whole night. That was all I was doing, just throwing up, and oh my gosh, it was so bad. And I think it was just because I wasn't kind to myself. I wasn't listening to my body. I wasn't taking care of myself in the way I should have. I wasn't taking it easy, you know. And then I came back and we went to New York, my mom and I, because I actually had gotten that as a birthday present, no, as a Christmas present from my mom. And I was feeling, you know, because I was still in denial and I felt like I can handle it, you know, it's not that bad, I'm strong, I'm gonna get through this. I didn't want to cancel anything. My mom kept saying, you know, we shouldn't go, and I was like, no mom, we're going. So we went to New York, and still during those 2 trips, I felt like I was still hyperthyroid, so I was definitely still having too much hormone. I was still going really fast all the time. I would get dizzy sometimes. I mean, I wouldn't let myself take a break. We were in New York, we came back, and by that time, all I was on was the blockers and the anti-thyroid medication and some beta blockers because of my heart, because they really wanted my heart rate to come down. I started doing like a combination therapy of anti-thyroid medication and Synthroid, I think in March, because that's when my TSH started to respond to the treatment. I wasn't feeling great. My skin was doing really, really bad. I had horrible eczema, but I have neurodermatitis, or I've had it ever since I was born. So I mean, that just kicked in like crazy, so I had really bad skin. I actually also had an allergic reaction to one of the thyroid blockers, so they had to change me to another one. You know, life was okay. I was going to uni. I was really tired. I mean, I was exhausted, but as I said, I wouldn't let myself take a break. I went to uni. I did more courses than I was supposed to, and I really wanted to take 2 exams, like I was just not giving myself a break. In May, my mom and I decided that I should get the surgery. Well, it was actually more of a family decision. All of us decided that that would be the best thing. And my endocrinologist was actually, she wasn't against it, but she wasn't all for it. She totally wanted me to do the medication therapy, and I was just like, I don't want to do this. Don't want to put my liver at risk, my white blood cells and everything. I don't want to do this. I want to get the surgery. So she called a surgeon, and he's actually a really, really good surgeon. He's a professor here in Switzerland. We read up on him a lot too, so I was feeling really safe going into this. And I had my total thyroidectomy, so the removal of the whole thyroid gland, on July 14th. And I was only in the hospital for about 3 days. It didn't hurt. It wasn't that bad, really. I wasn't really scared going into it either. I was just like, I gotta do what I gotta do, so I'm gonna do it. But what really bothered me was all of the stuff that happened to me after the surgery that nobody told me about. And everybody kind of knows that you fall into this hypo hell. I mean, really, the hypo really hit me so bad, and nobody told me that that was gonna happen, which really makes me mad. My scar healed pretty fast. They were really happy how well it healed. I took, and I am taking, really good care of it, and I'm just really happy with the decision of doing this surgery. I think it was the best decision I could have made. If you want a video all about the surgery, please let me know, because this video is already going to be extra long, like super long, and the surgery part would take up so much space. But if you want that, please let me know, and please write it in the comments and I'll do it. Now I live without a thyroid. You know, I had to let something go so I could get my life back. It's not an instant thing. It will still take a long time until I'm back to where I was. While I was on the thyroid blockers, I gained a lot of weight. It was crazy. As I said, I hadn't lost any weight, barely any weight before I was diagnosed. But then after I was diagnosed and I was on the blockers, I gained so much weight. And it was so hard for me because I could literally do anything. Like, it didn't matter what I did. I could not get rid of that weight. And I was getting really frustrated. I still am a bit frustrated because obviously I haven't lost it yet. I have lost about 4 kilos. I'm nowhere near what I looked like before. And I felt so heavy, and not just like heavy in my body, but heavy in my soul. It was really bad. And right now I'm actually not able to work out at all. I am not able to basically do anything that would help me lose weight except watch what I eat and take my thyroid hormones regularly and the way I'm supposed to. A couple of weeks or a few weeks after my surgery, I actually had to go back to the ER because I was running a fever, a really high fever. I had about 41 degrees Celsius fever. I don't know what that is in Fahrenheit. I'm gonna put it right here. But I was running a high fever, and I went to the ER because I was feeling so bad, and we actually called the hospital and asked what we should do, and they said, well, your surgery, it hasn't been that long since your surgery, you better come in and let us check it out and just make sure that it's not a complication from the surgery, etc, etc. So I did go into the ER, and seriously, that ER visit was ridiculous. Those doctors were ridiculous. Ugh, it's making me mad thinking about it right now because those doctors, they literally had no clue. We went there, I was feeling so bad. My heart rate, my blood pressure was sky high. It was crazy. I was feeling so sick. They were running all kinds of tests. They were just saying things, and I just realized like they did not know what they were talking about. They x-rayed my whole torso. They just did crazy stuff, and basically they didn't find anything. So my mom was like, is it possible that this is something related to her Graves' disease? Do you think this could be, you know, another wave of Graves? Like, what is happening? And the woman was like, no, when you get your thyroid removed, you're healed from Graves. You're cured. There's no way this has any connection. And my mom was like, are you sure? And the woman was like, definitely, that's not it. And they kept telling me you have a really bad infection somewhere and we can't find it and it must be huge. They checked my CR protein, which tells you if there's inflammation in the body. So they checked my CRP, it was crazy high. They gave me something so the fever would come down, but they basically had no clue. It was really upsetting me, and I was like, what is happening? Anyways, basically she came back after hours of testing. They did like all kinds of tests, and she was like, you have a really bad UTI, your whole urinary tract is infected, it's really bad. And I was like, I don't think so, because I actually can't feel anything. Like, my bladder wasn't hurting, like nothing. I was like, this is impossible. This is not it. And she was like, yes, you do, la la la. I was really mad. And I was so exhausted that I couldn't really comprehend what was happening. They sent me home. They gave me antibiotics. They gave me something against a fungus. They gave me something for a virus infection, like a virus thing. We call them virostatica. They just gave me everything they had basically and told me take it, and if it goes away, we're good. Which I did, and it did go away, but it obviously wasn't anything that they thought it was. And like all through the year, I've gotten fevers all the time. I had fevers like while I was on the blockers. I mean, every cold, everything that was around, I caught everything. I mean, my immune system was so weak. So between July and August, so between my surgery and my ER visit, I was feeling pretty okay. I was feeling pretty fine, and I thought that I had gotten over the worst and that it was just gonna get better from this point on. Well, it didn't. In September, as I said, the hypo, it hit me in the face out of nowhere. And nobody told me that I had to prepare for something like that. Nobody told me that that could happen or that very likely will happen. I was out with some friends one night. I was having some beer. I had one beer and I just started feeling so nauseous, so dizzy, crazy dizzy. I was getting so disoriented. I couldn't really talk. I got so scared. My heart was racing. I was like, I have to go. I have to go right now. I cannot stay in here for another second. Like, I was so dizzy and nauseous and shaky. I was cold. I was so cold. And I was inside. It was warm, you know, but I was freezing. And so I was just like, guys, I'm sorry, I have to go. Not doing good. So I left. And basically it was a whole lot of hypo symptoms and then some anxiety stuff that came into it. The next couple of days, I could barely get up. I was feeling super sad, but sad is not even the real word. I mean, I was literally depressed. I couldn't really get up. Everything was exhausting. Like, even just, I mean, taking a shower was like impossible to even think about. You know, I really tried to keep it together, but there were moments where I was like, this is it. You know, I can't take it. I can't take this. This is horrible. So I went back to my doctor, or I actually sent my doctor some emails, and I actually sent her some before, and the few times that I've been there before this happened, I told her, I was like, I feel some hypo symptoms. I was like, I really would like to up my dose a little bit of the synthyroid medication. And she was just very hesitant. She was like, no, I want you to wait. I want you to wait. And all the doctors kept telling me all the time was like, you have to wait. You just have to be patient. You just have to wait. You just have to be patient. And it really started to piss me off. I'm sorry for swearing, but that's just how it was. It really started to piss me off because it was like, what do you think I'm doing? What have I been doing for the past year. All I'm doing is waiting. All I'm doing is waiting for this to go by, and I'm losing all this time out of my life. I sent her an email and I said, I really want to up my dose. Something happened. I crashed. I'm really feeling so horrible. Please let me up my dose. And she just didn't reply. I mean, I felt so lost and I felt really alone. And of course my parents, they tried everything, you know, they were with me the whole time. My whole family, my brother too, Vince too, when he was here over the weekend. He's actually in the military right now, so the only time he's home is Saturday and Sunday. When he was here, he tried to help me too, but the thing is, nobody can really help you if you're in this kind of state. I just remember this one night I was having one of my friends over because I just felt like it wasn't good for me to be alone, especially when I was so sad. I mean, it was dark. So I had one of my friends over. We watched a movie, and the whole time during that movie, I mean, I was trying to laugh, I was trying to be, you know, normal, but I was just feeling so empty, and it was so weird because that's not me. And it really freaked me out that I was feeling these things and acting in ways that just weren't me, and that was so hard. I have had a few new symptoms that I've gotten recently. There's also some stuff that's getting better already. For example, I was losing loads of hair. I mean, seriously, it was crazy. I was going like that and I had so much hair in my hand. But that's actually better now. I can see all of those little baby hairs growing back. I was actually at the hairdresser's recently and she's like, you have loads of little baby hair. Did you have like major hair loss or something? I was like, yeah. My skin is so dry. I struggle with dry skin anyways, but right now it's really bad. And I mean, like, even the skin like inside my nose, my lips, my mouth, just every part of skin on my body is just so dry. One of the major things that happened is that I'm dealing with some anxiety, which I haven't, like, that is something that I've never struggled with before. For example, when we were at the movies, it was so loud and there were so many people and I almost started to get a little claustrophobic. And I felt like because it was so loud, I felt like I didn't have any room to move. I don't know, it's so weird to explain that, but those weird little anxiety things that happen, those were so annoying because it really stops me from doing a lot of stuff. There are so many little things, so many little symptoms, and if you add them up, sometimes it just gets too much and it's just too much to bear. Other days are okay, you know, some other days are fine. So it's a real roller coaster. To me, it's been going like this the whole time. I actually ended up upping my dose myself. I had 100 micrograms before and I upped it to 125, which isn't a massive jump. It's actually just a little bit of a difference. It started getting better, at least a little bit slowly, but still, I mean, there were days and there still are days where I'm like, I can't take this. I really hate what this is doing to me and to some relationships I have. I think it's just so hard because when you see me, you don't really know what's going on. You know, Graves is not a disease that people see. It's not obvious if you don't tell people. So, you know, you get comments like, you don't even look that sick. And I'm like, yeah. Or like, yeah, I think you have a psychological problem. Just stuff like that, and people mean well, but it just doesn't help. It's just frustrating. I am doing better. I'm not in this really bad spot anymore. It's crazy to think what impact it has on your health, on your self-image, on relationships with other people. Graves' disease and this thyroidectomy have changed my life from one minute to the next, and you know, I didn't have a say in it, it just happened. And sometimes that's so hard to accept. The most important thing is that you educate yourself. Go read up on, if it's Graves or whatever else, just read up on what you have. I know it's so scary, and I know, like, when I hear those horrible stories of people who've had horrible lives for years, dealing with those thyroid issues, it really scares me too. But I feel like knowledge is power, and the more I know and the more I learn, the more empowered I feel, and I feel like I can fight it. And it's also really important to me that you realize that doctors are just people. And there's a lot of doctors out there who don't have a clue. I actually changed doctors recently. Well, not recently, but in September, a couple months ago, because I was just not getting on with that other doctor. She was not listening to me. You know, she wasn't paying attention to what I was saying, and she was not taking me serious. She kept thinking I was totally exaggerating. I just was fed up with it. So I just changed doctors. About a month ago in October, I started a selenium therapy, which I had actually read a couple of studies that showed that if you take selenium supplements for about 6 months, twice a day, that it actually really helps people to feel better overall. People with thyroid issues, people who have had their thyroid removed, they have actually seen massive improvements in people who take selenium or who do one of those selenium therapies for 6 months. So that's what I'm doing right now. I'm a month into it. I definitely feel like it's doing something. I definitely feel better, but I also know that my hormones are not right yet. I'm actually thinking about going with some T3 right now. I'm only taking some thyroid T4 hormone, and I'm really thinking about getting some T3. I have a doctor's appointment tomorrow. I'm looking forward to talking to him and seeing what he thinks of this. I would love the comment section to be full of discussions and encouraging, nice comments. So if you have anything that you would like to add or anything you would like to ask me, please leave it in the comments. And I know that this video is really, really long. I'm sorry if you've been sitting here for like half an hour. Obviously I haven't edited it yet, so I don't know how long it's actually going to be, but it's going to be a really long video. I obviously wasn't able to cover everything. So if anybody is watching this who knows me personally, who has been going through this with me, I want to say thank you very much, because I couldn't do it without you. It's been really, really hard, and sometimes the only thing that gets you through this is a good hug or someone who tells you that they love you. Wow. I am gonna cry right now. Oh, I really told myself I wasn't gonna cry in this video. I tried really hard, almost did it. It got me in the end. Anyways, thank you so much for taking the time to watch this, because it means you're trying to understand me and my situation a little bit better, which means a lot to me. I'm just so thankful that I have such a great support system and so many people around me who love me and who really try their best, and they really try to be there for me. And I know it's not always easy. I know it's hard sometimes for the people around you, or around me. I know it's hard, but I'm just really, really thankful that I don't have to go through this alone. I'm gonna stop this right now or it's gonna get really, really emotional. Thank you for watching all of the others as well. Even if you don't know me, just thank you for watching. Have a great day, have a great evening, whatever you're doing. Just know that you're loved and it's gonna be okay. I will see you guys soon. Please take care. Bye.